Hello, sir. My name is Shayna. I'm going to be your nurse practitioner for this assessment. We're going to be doing skin, hair, nails, head, ears, eyes, nose, throat, and mouth. Essentially, I'm going to go through all these systems with you. Can you tell me your name and birth date?
John Smith, May 1st, 1990.
Do you have any questions before we proceed?
No.
Okay, we're going to start with the skin. Color is normal Caucasian color, uniform throughout, and it's symmetrical. Hygiene is good. No odors noted. Skin is moist. Well hydrated. Temperature. Warm throughout. Texture. Soft, supple. Next I'm going to assess turgor. Good turgor noted. Elastic. No issues there. Lesions. I noticed that you have some flattened areas, macules that are consistent with freckles. They're distributed across your face, your shoulders. I also noticed that you have some macules that are larger, more consistent with moles, varying between the size of 0.5 centimeters to a centimeter. Some are brown and pink in color. I also noticed that you have some papules on your neck, consistent with acne. Some do look red and inflamed with some whitish discharge. Do you have any pain or issues with your skin anywhere?
No.
Okay, next sir, I'm gonna look at your hair. Hair is brown in color. It is soft to touch, curly in nature, well distributed over the head, no areas of baldness noted. Also noted some facial hair, consistent throughout, brown in color, brownish red in color. I'm gonna palpate your scalp, sir. Scalp is soft, supple, moves. Any pain upon palpation?
No.
Next, looking at the fingernails and toenails. Nails are present on all digits and extremities. Nails have less than 3 seconds capillary refill. They're short and well kept. Cuticles have good blood flow, good coloration, no lesions noted, normal thickness, no clubbing noted, and nails are firm and well attached. Next, assessing the head. Head is midline, symmetrical. Are you able to turn your head, sir, for me in all directions? Any pain upon movement?
No.
No crepitus or cracking noted on head or neck movement. No tremors noted either. I'm also, once again, sir, going to palpate your head. Skull is firm, normal size and shape for an adult male. No lesions noted. Have you ever had any head trauma, sir?
No.
Okay. Face, symmetrical, all parts accounted for. Color is normal coloration for a Caucasian male. No facial tics noted. Neck, range of motion with the head and neck was normal. All movements present and accounted for. Neck is symmetrical, midline. I'm going to feel your neck, sir. Neck is soft, palpable, no signs of edema or fullness or thickness. Next, sir, I'm going to palpate your trachea. Trachea is midline. Can you swallow for me, sir? Good movement of the hyoid and cartilage. Next, I'm going to palpate your thyroid. Palpation of the thyroid shows that it is soft, normal consistency, no signs of nodules or enlargement, no feelings of swelling. Sir, can you swallow for me again? Normal movement upon swallowing. have you open and close your mouth, sir. Palpation of the temporomandibular joint is present. There's no crepitus, no cracking. Did you have any pain upon opening or closing, sir?
No.
Moving on to your lymph nodes, sir. I'm going to palpate various parts of your face looking for soft, movable pieces called lymph nodes. Preauricular, postauricular, submandibular, submental, occipital, sternocleidomastoid. Sir, can you turn to your right, please? Palpation of anterior deep cervical lymph nodes. None feel present. Sir, can you turn to your left, please? Again, no anterior deep cervical nodes palpated at this time. Next, I'm going to palpate posterior cervical and supraclavicular. Okay. Nothing warm, hard, immobile noted, no swelling noted. All lymph nodes appear normal at this time. Next, sir, I'm going to listen for bruits. These are abnormal blood flow through the blood vessels. Using the bell of my stethoscope, I'm going to listen to your temporal arteries. Normal blood flow noted, no bruit auscultated. Next, sir, I'm going to have you close your one eye, and I'm going to listen over your eye. I'm going to do the same thing with the other eye. Normal blood flow noted, no signs of a bruit. I'm going to listen to your thyroid, sir. Normal blood flow noted, no signs or symptoms of a bruit. Next, sir, I'm going to inspect your nose. Nose is of normal size, shape, and color. Matches the rest of the face. It is midline. Size is consistent for an adult male. Sir, may you look up at the ceiling for me? I'm going to look inside your nose. Mucosa is noted, is pink, normal in color. Septum is midline. No areas of concern noted, no access of mucus. With the alignment of the septum, there was no perforation noted. Next, I'm going to palpate your nose, sir. Any tenderness noted?
No.
Okay. No masses were felt, no bone or cartilage displacement was noted upon palpation. Next, sir, I'm going to do your patency of your nares. I'm going to occlude one side, and I want you to blow. And do the same thing. Both nares are patent. Airflow is noted bilaterally. Next, sir, I'm going to palpate your sinuses. I want you to let me know if you have any pain or tenderness. Maxillary sinus. Any pain, sir?
No.
Any pain?
No.
I'm going to do the same thing for your frontal. Any pain, sir?
No.
Any pain?
No.
Okay. Sinuses were normal in palpation. No enlargement noted, no swelling, and no pain or tenderness per the patient. Okay, sir, next we're going to do mouth and throat. Lips. Lips are normal color, pink, beefy, midline on the face. Lips are symmetrical in size, upper and lower. Lips are not swollen nor chapped. No lesions noted. Okay, sir, next I'm going to look at your teeth. Can you open your mouth for me? Teeth are white. All teeth are accounted for. No caries noted. Good hygiene, dental hygiene. None appear loose or missing. Next, we're gonna look at your gums and your tongue. May you stick your tongue out for me, sir? Normal coloration, symmetrical, midline, no signs of swelling. Gums, I'm just going to look at your gums, sir. Gums are pink, beefy, no signs of bleeding. Any tenderness, sir?
No.
They're symmetrical. Next, we're gonna look at your uvula, palate, tonsils, and postpharynx. So I'm gonna have you stick out your tongue for me. Okay. Tonsils are noted bilaterally. No swelling, no enlargement noted. Uvula is mobile, pink towards the back of the throat. Hard and soft palates are noted. Normal whitish pink color. Palates look firm, non-tender. Posterior wall of the pharynx was present. Tonsils were adhered well to the wall. Okay, sir, one more time. Can you swallow for me? Okay, next I would check for a gag, but we are not going to do that today. Okay, ears. Ears are in symmetrically located on bilateral head. Size and shape are normal for an adult male. No lesions or scar noted to either ear or pinna. Posterior of the ear is well intact. No issues with either ear. Next, looking just into the outer ear, normal pink color noted, no signs of cerumen, well, good hygiene noted. Look at the other ear. Similar findings bilaterally. Okay, sir. Next, I'm going to look into your ear with my otoscope. I'm going to look at your internal auditory canal and your tympanic membrane. Mild cerumen noted, tympanic membrane visible, pearly gray in color, handle of malleus was visible with a light reflex, and the pars tensa and pars flaccida were also visible. Moving to the other ear, we're going to do the same thing, sir. Mild cerumen noted to the auditory canal. Tympanic membrane present, pearly gray in color, handle of the malleus was noted, pars tensa and pars flaccida with a light reflex was observed bilaterally. Next, we're going to do 3 simple hearing tests, sir. One of them is going to be a whisper test. I'm going to stand behind you, and I'm going to say 3 letters. I want you to repeat them back to me, okay? I'm going to close this here.
F-E-G.
Beautiful. Now I'm going to do the same thing with this other ear. A-H-C.
A-H-C.
Perfect. Next, I'm going to do the Weber test, which is you're going to use a tuning fork. I'm going to place it in the middle of your head, and you're going to tell me if the sound is equal on both ears or louder on one side or the other.
Select.
Perfect. Next, I'm going to do the Rhine test. I'm going to place this behind your ear. You're going to tell me when you no longer hear it. Then I'm going to move it forward, and you're going to tell me when you no longer hear it. I'm going to do this to both ears.
Okay.
When you no longer hear it.
That's what I said, okay.
I'm gonna do the same thing with the other ear.
Okay. Okay.
Last, we're going to move on to the eye. First thing I'm going to do is I'm going to inspect and palpate the observable part of the eye. I'm going to look at the eyebrows. Eyebrows have good hair. Any pain or palpate or tenderness?
No.
Hair is well distributed. I'm going to palpate your orbitals. Bone is in normal placement. No cracking. No swelling noted. No lesions. Any pain there, sir?
No.
Eyelids are normal shape and consistency. No drooping or ptosis noted. No tremors. They are not red or swollen. Could you please shut your eye for me, sir? Or both eyes, I should say. Eyes closed well. Eyelashes are well distributed in a normal outward fashion. No trauma to the eye is apparent. Conjunctiva and sclera. I'm going to pull down your eye a little bit, sir. Conjunctiva and sclera. Sclera is white and normal in color. Can you look up towards the ceiling for me, sir? Perfect. Can you look down for me, sir? Normal whitish color noted. No discharge, no foreign bodies noted. Lacrimal gland is present. No issues with dry eye noted. Eyes are watering appropriately. Lacrimal gland is not swollen. Is it tender at all, sir?
No.
Okay. External eye. I'm going to darken the room. Okay. Look straight ahead at me. Pupils are equal and responsive to light. They are roughly a size 4. They accommodate well. No nystagmus was noted. Okay, sir, next we're going to do the Snellen visual eye chart. My eye chart wants it to be 6 feet away. Sir, what's the last line you can read on the chart?
LT FFH.
Do you wear glasses at baseline?
No.
Can you cover your one eye? Right eye. Okay, now read the last line you can read.
DHJ SS.
Okay. And then do the same thing with your opposite eye.
CFDHJ.
Beautiful. Okay. And then now I'm going to have you cover your one eye. Doesn't matter which, right or left. And I'm going to hold up numbers in all 4 quadrants. I want you to tell me what the numbers are.
2,
Look at me.
3, 4, 5.
Okay. Corneal clarity is noted. No Arcus. It's a grade 0. Corneal sensitivity. Okay, sir, I'm going to have you look to your left. Can you feel that?
Yes.
Okay, now look to the right. Can you feel that?
Yes.
Sorry. Okay, same thing with the other eye. Can you feel that?
Yes.
Okay, look the other way. Okay,
Yes.
okay, thank you. Iris color is hazel bilaterally. Okay. I'm gonna have you cover your one eye. Okay, follow my finger. Okay, now cover the other eye. Movement is smooth, and no issues noted. Okay, now follow it with both. Movement is together. No issues with jerking, or any signs of nystagmus. Okay. I'm gonna flash a light in your eyes, look straight ahead. Corneal light reflex is midline bilaterally and symmetrical. Last but not least, I'm gonna use my ophthalmoscope to assess the eye. Okay. First thing I'm gonna look for is the red light reflex. Red light reflex is present and accounted for. Do the same thing with the other eye. Red light reflex is present and accounted for. Next, I'm going to look at the back of your eye, sir. Looking at the optic disc. Optic disc is present, orange in color. Optic disc is present, orange in color. No lesions were noted. Retinal vessels were present. Veins are larger than the arteries. Physiologic cup is present. Same in this eye. Physiologic cup is present. Veins are larger than the arteries. The fova was present with light reflection. Last but not least, we're going to look at your anterior depth chamber. Measures to be about 3 centimeters. We're going to do the same thing on this side. Same thing, about 3 centimeters. Vitreous body and lens was also present. Fova was noted with light reflection in both eyes. Any questions, comments, or concerns, sir?
No,
Thank you for your time today. I appreciate it.
thank you.